Hi, Dr. Cheng.
Hi, Yanni. How are you?
Good. How are you?
I'm well, thank you. Thanks for having me here. I really appreciate the opportunity.
Thank you for accepting my interview. You are an emergency doctor at Markham Stouffville Hospital, MSH.
That's correct.
That is one of the hospitals currently fighting COVID-19 pandemic. But last week, there was an incident. You treated a patient who experienced a racist hate crime. Can you tell us a little bit about that incident?
Yes, I'd be happy to. So the patient that I treated was very gracious and gave me consent to talk about this incident. And this happened within the last week. And although he gave me consent, I didn't want to give too many details to still protect his identity. But I will tell you this happened in downtown Toronto approximately 1 week ago. And my patient was on Yonge Street with his girlfriend. And my patient was in his car. And his girlfriend was outside of the vehicle. And at that point, she was assaulted by a man who was saying or yelling that she's Chinese and was responsible for coronavirus somehow, which obviously is not true. So very understandably, my patient got out to try to defend his girlfriend. And then the assailant was joined by two additional men who all three of them proceeded to assault my patient. So again, it's very unfair. There were three assailants versus one person. And the long and the short of it was that my patient suffered a broken arm.
So then he went to your hospital and then you treated him.
Yes. So
how serious that was?
He came and while I'm treating patients, I'll chat with them about what happened, and he was such a lovely young man. He actually didn't really tell me a lot of stuff on his own. Like I was actually asking him questions, so he wasn't complaining about anything. He was very stoic. And so my questions to him were, how did you feel? Like, how does this make you feel? And he was just so accepting of what had happened. He wasn't angry. He just said, this happens. And he, again, wasn't angry at all. And that, as I had said in the previous CBC interview, it just made me really sad that he was so resigned to accept this as an understandable action. And in my opinion, I just thought this is not understandable by any means and completely unacceptable.
Yeah. You're a doctor. Have you experienced any discrimination at your workplace?
I myself have not. I'm very fortunate. Again, I work at Markham Stouffville Hospital, and I work and I live in this community where we are actually 53% non-white. So we live in one of the most diverse communities in the country. So I think that's one of the reasons that I haven't experienced racism. So I live in a wonderful environment, and my workplace is also a very diverse environment as well. And I guess the last piece of it I would say is that from common sense alone, if somebody had racist thoughts and beliefs, it just wouldn't make sense for them to express them to their doctor. So because of that, I haven't, but I'm not naive enough to assume that this doesn't happen. So I know that, so I'm a faculty member at the University of Toronto, and our Faculty of Medicine, they do wonderful work. There was a project where they interview our residents and our medical students about their experiences. And we have hard data, we have hard evidence where our learners are experiencing maltreatment based on race, based on religious identity, based on sexual orientation. And so sometimes, sadly, patients will say terrible things to these residents. For example, I don't want this person to treat me because, fill in the blank, because they are of a certain race or religious identity or sexual orientation. So it does happen. I know of a friend who's an emergency physician in Australia who has experienced racism at her workplace. So although I'm so lucky it hasn't happened to me, I know it does happen.
Mm-hmm. So what do you think as a Chinese Canadian? Because lots of people would say, "Oh, nowadays, Canada is so diverse, so multiculturalism." What do you think of this issue? The racial tension still there, the discrimination still there. What do you think?
Well, I think the answer is complex, and I don't think it's all black and white. So I think the first thing I would say is Canada is an amazing country, and I would choose to live here over any other country in the world. In fact, I have chosen to live here. I lived in the United States for a number of years, and that did solidify my decision to choose Canada to live and raise my children. So I think we do wonderful, wonderful work in terms of acceptance, inclusion, and diversity. But on the flip side of that coin, I think we would be foolish to ignore the fact that racism does exist. And it's an important thing. If we're going to fix a problem, we must first acknowledge that it does exist. And I think that's a really hard conclusion for a lot of people to draw because it's not nice. It's unpleasant, but it is reality. And we can't solve this problem until we first identify that it is a problem. And I think there are multiple reasons why people may not realize it's a problem. Number one, if you've never experienced it and you've never seen it for yourself firsthand, then of course, why would you even know it was a problem? The second problem, I think, too, has to do with reporting. So, I think you've heard of lots of incidents of this, and you're well aware, but I've seen a number of either on social media or personal anecdotes where, for example, Asians have been they have not been permitted to enter an elevator. So an elevator will arrive, there'll be somebody in the elevator, and the Asian person waiting to get on won't be allowed to get on the elevator because they're Asian. A friend told me about a nurse from Sick Kids, I think maybe in the last 48 hours, who was leaving their shift and getting on the subway, and somebody in the subway spat on them. But who would you tell about this? Number one, you'd have to make the connection that this happened because of who you are, not because of something you've done. And then who would you tell? Would you call the police? And what would you tell them? Because we all, I think it's really true. The police are really, really busy trying to catch bad guys. And I'm going to call them and tell them, well, somebody spat on me and I don't know who it was and I have no means to identify them. So, there's nothing to be done. This elevator business, who are you going to tell? So I guess, for people who suffer from this, number one, they have to make the connection, this was a racist incident. And now what do you do with that information?
Mm-hmm. Yeah, so now there's increasing hate crime against the Asian community. What's your suggestion or what's your advice to the people who have this incident at the moment or afterwards, or what they should do? What's your suggestion?
So that's a great question, and I certainly don't purport to be an expert in this area, but I think, and whether it's anti-Asian or any kind of discriminatory behavior, certainly if you are a witness to it, number one, you should be safe. If you need to call 911, call 911. Don't put yourself in physical danger, of course. But I think for if I don't want to speak for all victims, but if it were me, I know I would certainly appreciate some show of support, even just to say, are you okay? I'm just going to stand here with you, although socially distanced, to make sure you're okay to get to where you need to go. Mm-hmm. Certainly I guess my purpose in bringing this up is that, again, the shock of it happening sometimes can render you immobile and speechless until, the wheels start turning again and you start thinking, well, wait a minute, did that just actually happen? And I think that was racist and maybe I should say something, and then the moment is over and you've missed your opportunity. And then it can be doubly traumatizing because now the first trauma was the incident happening, and the second trauma is feeling like you were helpless and you should have done something and you didn't. So I would ask your listeners and your viewers to maybe think about some scenarios where this might happen to you, and what would your response be? What would your action be? What would your words be? Would you maybe have your camera out and put it on record and take a video, call 911, all kinds of preparation, just like we're preparing in our emergency department for our patients. You can do this as well, so that if it ever happens, then you'll be more ready than without preparation.